Question 1. The assessment process reveals a canine patient presenting with severe external bleeding from multiple lacerations, rapid and shallow breathing, pale mucous membranes, and a weak, rapid pulse following a motor vehicle accident. Which of the following initial actions best aligns with emergency protocols for trauma patients? Option A. Administer a broad-spectrum antibiotic and pain medication intravenously without further assessment. Option B. Begin a detailed questioning of the owner regarding the patient's vaccination history and any pre-existing conditions. Option C. Immediately establish intravenous access for fluid resuscitation and administer supplemental oxygen. Option D. Focus on cleaning and bandaging all visible wounds before assessing vital signs. The correct answer is C. Immediately establish intravenous access for fluid resuscitation and administer supplemental oxygen. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a critically ill patient with a potentially life-threatening condition, requiring rapid and accurate assessment and intervention. The registered veterinary technician, RVT, must prioritize actions based on the patient's immediate needs while adhering to established emergency protocols and veterinary guidance. The urgency of the situation demands decisive action, but also careful consideration to avoid causing further harm or delaying essential treatment. Correct approach analysis. The correct approach prioritizes immediate stabilization and life support, which is paramount in emergency situations. This aligns with the core ethical and regulatory responsibilities of an RVT to provide competent care and act in the best interest of the animal. Establishing intravenous access for fluid resuscitation and medication administration, along with providing supplemental oxygen, directly addresses the immediate physiological derangements associated with severe trauma, such as hypovolemic shock and hypoxia. This proactive stabilization allows for more thorough diagnostic workup and definitive treatment to follow. This approach is supported by Veterinary Practice Acts and professional guidelines that mandate RVTs to assist in emergency care under veterinary supervision, prioritizing life-saving measures. Incorrect approaches analysis. One incorrect approach involves delaying essential stabilization to gather extensive historical information. While a thorough history is important in a critical trauma case, delaying intravenous access and oxygenation can lead to irreversible organ damage or death. This failure to prioritize immediate life support constitutes a breach of the RVT's duty of care and may violate regulations requiring prompt and appropriate emergency intervention. Another incorrect approach is to administer medications without establishing intravenous access or assessing the patient's hemodynamic status. This can be dangerous, as certain medications may exacerbate hypotension or have unpredictable effects in a compromised patient. It bypasses fundamental emergency principles of stabilization and could lead to adverse drug reactions or worsening of the patient's condition, representing a failure to adhere to safe and accepted veterinary nursing practices. A further incorrect approach is to focus solely on pain management without addressing the underlying physiological instability. While pain control is important, it is secondary to ensuring adequate oxygenation and circulatory support in a trauma patient. Neglecting these critical elements can lead to a poor prognosis, even if the patient appears more comfortable and demonstrates a failure to apply comprehensive emergency management principles. Professional reasoning. When faced with a critical emergency, the RVT should employ a systematic approach, often referred to as ABC's airway, breathing, circulation, followed by D, disability/neurological status, and E, exposure/environment. In this trauma scenario, the immediate focus is on ensuring a patent airway, adequate breathing, oxygenation, and stable circulation, intravenous access, fluid therapy. This structured approach, guided by veterinary protocols and the veterinarian's instructions, ensures that the most life-threatening issues are addressed first, maximizing the patient's chances of survival and recovery. Question 2. The audit findings indicate a registered veterinary technician, RVT, is reviewing a case involving a 6-month-old Labrador retriever exhibiting significant fear-based barking and cowering when exposed to new people and objects in the home. The owner reports this behavior has been present since the puppy was introduced and is concerned about its progression. The RVT needs to recommend an initial course of action. Which of the following approaches best aligns with current best practices and ethical considerations for RVTs in managing fear-based behaviors in young dogs? Option A. Advise the owner to increase the dog's daily exercise and provide more chew toys to distract it from its fearful reactions. Option B. Inform the owner that this is typical puppy behavior and to wait until the dog is older before considering any intervention. Option C. Develop a structured desensitization and counter-conditioning program, focusing on gradual exposure to triggers at sub-threshold levels paired with positive reinforcement, and educate the owner on recognizing and managing the dog's stress signals. Option D. Recommend the immediate use of a bark collar and firm verbal reprimands whenever the dog exhibits fearful barking. The correct answer is C. Develop a structured desensitization and counter-conditioning program, focusing on gradual exposure to triggers at sub-threshold levels paired with positive reinforcement, and educate the owner on recognizing and managing the dog's stress signals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered veterinary technician, RVT, to balance the immediate needs of a distressed animal with the long-term behavioral goals and the owner's capacity to implement training. The RVT must assess the situation critically, considering the animal's welfare, the potential for habituation to negative stimuli, and the owner's understanding and commitment to training principles. Failure to address the underlying causes of fear and anxiety can lead to persistent behavioral issues, impacting the animal's quality of life and potentially leading to reharming or euthanasia. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the dog's fear-based behaviors and the development of a tailored, positive reinforcement-based training plan in collaboration with the owner. This aligns with the ethical obligations of an RVT to promote animal welfare and provide client education. By focusing on desensitization and counter-conditioning, the RVT addresses the root cause of the fear, aiming to change the dog's emotional response to the trigger. This method is evidence-based, humane, and promotes a strong human-animal bond, which is a cornerstone of responsible veterinary care. It also empowers the owner with practical skills and knowledge, fostering compliance and long-term success. Incorrect approaches analysis. One incorrect approach involves solely recommending increased exercise and distraction. While exercise can be beneficial for overall well-being, it does not address the underlying fear or anxiety. This approach fails to tackle the core issue and may only mask the symptoms, potentially allowing the fear to escalate or become more ingrained. Ethically, this is a failure to provide adequate behavioral modification advice. Another incorrect approach is to suggest immediate punishment or aversive techniques to suppress the barking. This is a significant regulatory and ethical failure. Such methods can exacerbate fear and anxiety, damage the human-animal bond, and lead to aggression. They are contrary to modern, science-based animal behavior modification principles and can violate animal welfare regulations by causing undue distress. A third incorrect approach is to dismiss the owner's concerns as normal puppy behavior and advise waiting for the dog to grow out of it. This demonstrates a lack of professional diligence and a failure to recognize the potential for serious behavioral issues to develop. Delaying intervention can make it significantly harder to modify the behavior later, impacting the dog's long-term welfare and the owner's ability to manage the pet. This is a failure in client education and proactive care. Professional reasoning. Professionals should approach such situations by first conducting a thorough behavioral history and observation. This should be followed by developing a behavior modification plan that is humane, effective, and owner-compliant. Collaboration with the owner is paramount, ensuring they understand the rationale behind the plan and are equipped to implement it. If the behavior is severe or complex, referral to a veterinary behaviorist or certified applied animal behaviorist should be considered. The decision-making process should always prioritize the animal's welfare, adhere to ethical guidelines, and comply with all relevant veterinary practice acts and regulations. Question 3. Which approach would be most effective for a registered veterinary technician to explain the fundamental differences in the structure and function of animal cells to a new veterinary assistant with limited prior biological training, ensuring practical relevance to veterinary practice? Option A. A comparative analysis of key organelles and cellular processes, illustrating their roles in different animal tissues and common clinical conditions. Option B. A chronological history of cell discovery and the evolution of cell theory, with minimal focus on specific organelle functions. Option C. A detailed lecture-style presentation of each organelle's biochemical pathways and molecular mechanisms, as found in advanced textbooks. Option D. A simplified overview focusing only on the nucleus and cytoplasm, using broad analogies unrelated to animal physiology. Correct answer is A. A comparative analysis of key organelles and cellular processes, illustrating their roles in different animal tissues and common clinical conditions. Explanation. Scenario analysis. A registered veterinary technician, RVT, is tasked with educating a new veterinary assistant on basic animal cell biology. The challenge lies in tailoring the information to the assistant's existing knowledge level and ensuring the explanation is accurate, relevant to veterinary practice, and adheres to professional standards of communication and education within the veterinary field. Misinformation, or an overly complex explanation, could hinder the assistant's learning and potentially impact patient care. Correct approach analysis. The most effective approach involves a comparative analysis of animal cell structures and their functions, relating them directly to common veterinary scenarios. This method leverages the assistant's potential prior exposure to comparative concepts and makes abstract cellular processes tangible by linking them to observable physiological functions or pathologies encountered in a veterinary setting. For instance, comparing the structure and function of mitochondria in different cell types, e.g., muscle cells vs. nerve cells, and explaining how their efficiency impacts an animal's ability to move or respond, or how mitochondrial dysfunction can manifest in disease. This approach aligns with the RVT's role in client and staff education, promoting a deeper understanding that is immediately applicable to their work, thereby upholding professional standards of knowledge dissemination and competence. Incorrect approaches analysis. One incorrect approach would be to present a purely theoretical, textbook-driven overview of each organelle in isolation, without any practical veterinary context. This fails to engage the learner effectively and does not demonstrate the RVT's ability to translate scientific knowledge into practical application, a core competency. Ethically, it represents a failure to provide effective training. Another incorrect approach would be to focus solely on the most complex and specialized cell types, assuming a level of prior biological knowledge that the assistant may not possess. This can overwhelm the learner and create confusion, rather than fostering understanding. It demonstrates a lack of pedagogical skill and an inability to adapt teaching methods to the audience, which is unprofessional. A third incorrect approach would be to rely on analogies that are not directly relevant to biological systems or veterinary medicine. While analogies can be helpful, using ones that are too abstract or unrelated can lead to misconceptions and a superficial understanding of cellular processes. This shows a lack of critical thinking in educational material selection and can be misleading, thus failing to meet professional standards of accuracy. Professional reasoning. When educating colleagues or clients, RVTs must employ a decision-making process that prioritizes clarity, accuracy, and relevance. This involves assessing the learner's background, identifying learning objectives, and selecting teaching methods that best facilitate understanding. A comparative and context-driven approach, as described, is superior because it builds upon existing knowledge, makes abstract concepts concrete, and directly links cellular function to observable outcomes in animal health. This ensures that the information imparted is not only scientifically sound, but also practically useful and ethically delivered, reinforcing the RVT's role as a knowledgeable and effective communicator. Question 4. The review process indicates that an RVT has performed a urinalysis on a canine patient presenting with lethargy and decreased appetite. The results show a specific gravity of 1,010, a moderate amount of protein, and numerous white blood cells and bacteria in the sediment. The RVT is asked to provide an initial assessment of the findings to the supervising veterinarian. Which of the following represents the most appropriate and professionally responsible approach for the RVT? Option A. Inform the veterinarian that the low specific gravity indicates the dog is likely dehydrated and the protein and white blood cells suggest kidney damage, recommending immediate fluid therapy and a kidney biopsy. Option B. Conclude that the patient has a severe urinary tract infection and prescribe a broad-spectrum antibiotic and recommend a follow-up urinalysis in 48 hours. Option C. Report the specific gravity, protein, and microscopic findings to the veterinarian, noting the presence of bacteriuria and puria, and suggest that a urinary tract infection is a strong possibility requiring further investigation and treatment. Option D. State that the urinalysis is normal despite the presence of protein and white blood cells, as the specific gravity is within a broad acceptable range, and advise the veterinarian to focus on the dog's diet. The correct answer is C. Report the specific gravity, protein, and microscopic findings to the veterinarian, noting the presence of bacteriuria and puria, and suggest that a urinary tract infection is a strong possibility requiring further investigation and treatment. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a registered veterinary technician, RVT, must interpret urinalysis results to guide immediate patient care. The challenge lies in synthesizing multiple data points, physical, chemical, and microscopic, and correlating them with the patient's clinical presentation to make informed recommendations. The RVT must not only identify abnormalities, but also understand their potential significance and implications for the patient's prognosis and treatment plan, all while operating within their scope of practice and adhering to established protocols. Correct approach analysis. The correct approach involves a comprehensive review of all urinalysis parameters, correlating them with the patient's clinical signs and history. This aligns with the RVT's role in assisting with diagnosis and treatment by providing accurate and relevant data interpretation. Best professional practice dictates that the RVT should present a synthesized interpretation to the veterinarian, highlighting significant findings and potential differential diagnoses or treatment considerations. This ensures that the veterinarian has all necessary information to make the final diagnostic and therapeutic decisions, upholding the collaborative nature of veterinary medicine and the RVT's supportive role as defined by Veterinary Practice Acts and professional guidelines. Incorrect approaches analysis. An approach that focuses solely on one abnormal parameter without considering the others or the clinical context is a regulatory and ethical failure. It demonstrates a lack of comprehensive analysis and can lead to misdiagnosis or inappropriate treatment recommendations. This fails to meet the standard of care expected of an RVT, which requires a holistic interpretation of diagnostic data. Another incorrect approach is to make definitive diagnoses or prescribe treatment based on urinalysis findings. This directly exceeds the RVT's scope of practice, which is to assist the veterinarian, not to independently diagnose or prescribe. Such actions would violate Veterinary Practice Acts and professional conduct guidelines, potentially leading to disciplinary action. Finally, an approach that ignores or downplays significant abnormalities because they do not fit a preconceived notion of the patient's condition is also professionally unacceptable. This represents a failure in critical thinking and adherence to diagnostic protocols, potentially jeopardizing patient welfare by delaying or preventing necessary interventions. It also undermines the integrity of the diagnostic process. Professional reasoning. Professionals should approach urinalysis interpretation by first systematically evaluating each component: physical color, clarity, specific gravity, chemical pH, protein, glucose, ketones, bilirubin, urobilinogen, occult blood, nitrite, and microscopic cells, casts, crystals, bacteria, yeast. Each finding should be considered in isolation, and then in conjunction with other findings and the patient's clinical presentation. The RVT's role is to identify and report significant deviations from normal, and to provide a preliminary interpretation to the veterinarian, suggesting potential implications. This structured approach ensures thoroughness, accuracy, and adherence to professional responsibilities. Question 5. The analysis reveals a significantly lower than expected platelet count on a canine patient's complete blood count, CBC. The RVT has reviewed the initial manual differential and noted no obvious platelet clumping in the peripheral blood smear. The patient is presenting with no overt signs of bleeding. Which of the following actions best optimizes the diagnostic process and ensures accurate reporting? Option A. Immediately report the low platelet count to the veterinarian, assuming it reflects a true thrombocytopenia. Option B. Re-examine the blood smear carefully for platelet satellitism and consider a fresh EDTA tube for a repeat platelet count. Option C. Adjust the automated analyzer settings to compensate for potential interference. Option D. Focus solely on the automated analyzer's results and disregard the manual differential findings. The correct answer is A. Immediately report the low platelet count to the veterinarian, assuming it reflects a true thrombocytopenia. Explanation. The analysis reveals a common scenario in veterinary hematology where a critical blood component count is unexpectedly low, necessitating immediate and accurate assessment. This situation is professionally challenging because it directly impacts patient diagnosis and treatment planning. The registered veterinary technician, RVT, must not only possess a strong understanding of normal hematological values, but also be adept at identifying potential sources of error in sample collection, processing, or analysis. The urgency of the situation, coupled with the potential for misinterpretation, demands meticulous attention to detail and adherence to established protocols. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation of the discrepancy. This involves a thorough review of the patient's history, a reevaluation of the blood smear for morphological abnormalities or artifacts, and potentially repeating the analysis with a fresh sample. This methodical process ensures that the low count is not a result of pre-analytical or analytical error, thereby safeguarding the integrity of the diagnostic information provided to the veterinarian. Adherence to established laboratory standard operating procedures, SOP, and regulatory guidelines for veterinary diagnostics is paramount. An incorrect approach that involves immediately reporting the low count without further investigation is a significant regulatory and ethical failure. This bypasses critical quality control measures and could lead to misdiagnosis and inappropriate treatment, potentially harming the patient. It demonstrates a lack of due diligence and a failure to uphold the professional standard of care expected of an RVT. Another incorrect approach, such as attributing the low count solely to a disease process without considering technical factors, ignores the possibility of laboratory error and can lead to premature or incorrect conclusions. This is a failure to apply critical thinking and a deviation from best practices in diagnostic interpretation. The professional reasoning process for similar situations should involve a structured approach. 1. Verify the result against patient history and clinical signs. 2. Review the methodology and equipment used for analysis. 3. Examine the blood smear for any visual clues or artifacts. 4. Consider pre-analytical factors e.g., sample collection, anticoagulation, storage. 5. If a discrepancy persists, repeat the analysis, potentially with a fresh sample, and consult with colleagues or the supervising veterinarian. This systematic approach ensures accuracy, patient safety, and compliance with professional standards. Question 6. Quality control measures reveal that a veterinary technician is consistently encountering difficulties, restraining a fearful and anxious canine patient for routine physical examinations. The technician's current practice involves immediately attempting to physically restrain the dog, often resulting in increased vocalization and struggling from the animal. What is the most appropriate and ethically sound approach for the technician to adopt in this situation? Option A. Create a calm and quiet environment. Speak in a soft, reassuring tone and offer small, high-value treats intermittently during the examination to build trust and reduce anxiety. Option B. Apply firm, consistent physical restraint from the outset to prevent the dog from escalating its fearful behavior. Option C. Proceed with the examination as quickly as possible, minimizing physical contact to reduce the duration of the stressful interaction. Option D. Immediately administer a pre-anesthetic sedative as prescribed by the veterinarian before any attempt at physical restraint is made. Correct answer is A. Create a calm and quiet environment, speak in a soft, reassuring tone, and offer small, high-value treats intermittently during the examination to build trust and reduce anxiety. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a patient exhibits fear and anxiety, making routine handling and restraint difficult and potentially dangerous for both the animal and the veterinary technician. The technician must balance the need for accurate diagnostic information with the animal's welfare and safety, requiring a nuanced understanding of stress reduction techniques. The challenge lies in selecting the most appropriate and least stressful method for the specific patient and procedure, adhering to professional standards of care. Correct approach analysis. The correct approach prioritizes the animal's emotional state and employs techniques known to reduce fear and anxiety. This aligns with the ethical obligations of veterinary professionals to provide compassionate care and minimize patient distress. Utilizing a calm, quiet environment, speaking in a soothing tone, and offering positive reinforcement are evidence-based stress reduction techniques that promote a cooperative patient and a safer, more efficient examination. This approach reflects a commitment to the principles of animal welfare and professional conduct expected of a registered veterinary technician. Incorrect approach is analysis, an approach that immediately resorts to forceful restraint without attempting any stress reduction measures fails to meet the standard of care. This can exacerbate the animal's fear, leading to increased resistance, potential injury to the animal or staff, and a compromised examination. Ethically, it demonstrates a disregard for the animal's well-being and a lack of professional judgment in applying appropriate handling techniques. An approach that relies solely on sedation, without first attempting non-pharmacological stress reduction techniques, may be an over-reliance on medication. While sedation can be a valuable tool, it should ideally be a secondary consideration after exploring less invasive methods. This approach might indicate a lack of skill or willingness to engage with the animal's behavioral cues, potentially leading to unnecessary chemical restraint and its associated risks. An approach that involves ignoring the animal's signs of stress and proceeding with the examination, as if the animal were calm, is a direct failure to recognize and address patient welfare. This demonstrates a significant lapse in observational skills and professional responsibility, potentially leading to a traumatic experience for the animal and a breakdown of trust between the animal, owner, and veterinary team. It violates the fundamental ethical duty to prevent unnecessary suffering. Professional reasoning. When faced with a fearful or anxious animal, a registered veterinary technician should employ a decision-making framework that begins with observation and assessment of the animal's body language. The technician should then consider a hierarchy of interventions, starting with environmental modifications and behavioral techniques, e.g., quiet environment, calm voice, positive reinforcement. If these are insufficient, then pharmacologic interventions, e.g., mild sedatives or anxiolytics, may be considered in consultation with a veterinarian. The ultimate goal is to achieve the necessary diagnostic or therapeutic outcome with the least amount of stress and risk to the animal. Question 7. Market research demonstrates that clients often present their pets with a range of subtle to overt clinical signs. An RVT is presented with a dog exhibiting lethargy, decreased appetite, and mild abdominal discomfort upon palpation. The owner mentions the dog has been more thirsty than usual. Which of the following approaches best reflects the RVT's immediate professional responsibility in assessing this situation? Option A. Focus solely on the owner's report of increased thirst and recommend a diet change to address potential dehydration. Option B. Immediately administer intravenous fluids and a broad-spectrum antibiotic, assuming a systemic infection is present. Option C. Advise the owner to administer a mild pain reliever and monitor the dog for a few days, as these signs are often indicative of minor gastrointestinal upset. Option D. Perform a comprehensive physical examination, including vital signs, and communicate all findings and concerns to the supervising veterinarian for further diagnostic and treatment planning. The correct answer is D. Perform a comprehensive physical examination, including vital signs, and communicate all findings and concerns to the supervising veterinarian for further diagnostic and treatment planning. Explanation. Scenario analysis. This scenario presents a challenge because it requires the registered veterinary technician, RVT, to interpret and apply knowledge of animal anatomy and physiology in a practical, diagnostic context. The RVT must differentiate between signs that are indicative of a common, minor issue versus those that suggest a more serious underlying condition requiring immediate veterinary intervention. Misinterpreting these signs could lead to delayed treatment, patient suffering, or even a negative outcome, impacting animal welfare and client trust. Correct approach analysis. The correct approach involves a systematic assessment of the animal's presenting signs, correlating them with known anatomical and physiological functions, and recognizing deviations from normal. This requires a thorough understanding of the species-specific physiology, common pathologies, and the ability to perform a competent physical examination. By prioritizing the assessment of vital signs and the identification of potential pain or distress, the RVT acts as a crucial first line of defense, ensuring that critical issues are not overlooked and that appropriate diagnostic and treatment pathways are initiated promptly. This aligns with the RVT's role in providing skilled nursing care and assisting in diagnosis and treatment under veterinary supervision, upholding the highest standards of animal welfare, as mandated by veterinary practice acts, and professional ethical guidelines. Incorrect approach is analysis. One incorrect approach involves dismissing the signs as minor without a comprehensive physical examination. This fails to meet the standard of care expected of an RVT, as it bypasses essential diagnostic steps. Ethically, it could be considered negligence if a serious condition is missed. Legally, it could violate veterinary practice acts that require RVTs to act under veterinary supervision and to recognize and report changes in an animal's condition. Another incorrect approach is to immediately administer over-the-counter medications without veterinary direction. This is a significant regulatory and ethical failure. RVTs are typically prohibited from prescribing or dispensing medication without a veterinarian's order. Furthermore, administering inappropriate medication could mask symptoms, delay proper diagnosis, or even be harmful to the animal, directly contravening the principle of do no harm. A third incorrect approach is to rely solely on the owner's subjective description of symptoms without performing objective assessments. While owner input is valuable, it is not a substitute for a professional veterinary assessment. An RVT's responsibility includes gathering objective data through physical examination and diagnostic tests. Failing to do so represents a dereliction of professional duty and could lead to misdiagnosis and inappropriate treatment plans, violating ethical obligations to the animal patient. Professional reasoning. When faced with a patient exhibiting concerning signs, the professional decision-making process for an RVT should begin with a thorough, systematic physical examination. This includes assessing vital parameters, temperature, pulse, respiration, capillary refill time, observing the animal's demeanor, and palpating relevant anatomical structures. The RVT should then correlate these findings with the presenting complaint and their knowledge of animal physiology and common diseases. If any findings suggest a serious or life-threatening condition, or if the diagnosis is unclear, the RVT must immediately communicate these findings to the supervising veterinarian for further assessment and direction. This tiered approach ensures that animal welfare is prioritized, diagnostic accuracy is maximized, and regulatory requirements for veterinary supervision are met. Question 8. During the evaluation of a canine patient presented for a routine dental cleaning, the registered veterinary technician observes the dog is reluctant to shift its weight onto its hindquarters when standing, exhibits a slight tremor when handled, and its ears are held in a more flattened position than usual. The dog is not vocalizing or showing overt aggression. Which of the following actions best reflects the RVT's professional responsibility in assessing for pain and distress? Option A. Advise the owner that the dog appears anxious and suggest they consider delaying the procedure until the dog is less stressed, without further veterinary assessment of pain. Option B. Note the behaviors but consider them minor and not indicative of significant pain, as the dog is not exhibiting overt signs like yelping or struggling. Option C. Proceed with the dental cleaning as scheduled, assuming the observed behaviors are due to the unfamiliar environment and will resolve once the dog is more settled. Option D. Document these observations and report them to the veterinarian, recommending a reassessment of the patient's comfort level and potential need for pre-procedure pain medication. The correct answer is D. Document these observations and report them to the veterinarian, recommending a reassessment of the patient's comfort level and potential need for pre-procedure pain medication. Explanation. This scenario is professionally challenging because accurately assessing pain and distress in animals, especially those that cannot verbally communicate, requires keen observation, interpretation of subtle behavioral cues, and an understanding of species-specific responses. The registered veterinary technician, RVT, must synthesize multiple pieces of information to form a professional judgment, balancing the animal's welfare with the need for diagnostic or therapeutic procedures. This requires a deep understanding of the ethical and regulatory obligations to prevent animal suffering. The correct approach represents best professional practice because it prioritizes the animal's immediate welfare by recognizing and responding to potential signs of pain or distress. This aligns with the core ethical principles of veterinary medicine, which mandate the prevention of cruelty and the alleviation of suffering. Specifically, regulatory frameworks for RVTs, such as those governed by Veterinary Practice Acts and professional conduct guidelines, require RVTs to act in the best interest of the animal patient. This includes recognizing signs of pain and distress and communicating these observations to the veterinarian for appropriate intervention. Failing to do so could be considered a breach of professional duty and potentially violate animal welfare laws. An incorrect approach that overlooks or dismisses subtle behavioral changes as normal or insignificant fails to uphold the RVT's duty of care. This could lead to prolonged or unnecessary suffering for the animal, which is a direct violation of ethical standards and potentially regulatory requirements regarding animal welfare. Another incorrect approach that relies solely on the absence of overt vocalization or dramatic physical reactions is also problematic, as many animals exhibit stoic or subtle signs of pain. This demonstrates a lack of understanding of the nuances of animal behavior and pain expression, leading to a failure to advocate for the animal's needs. An approach that prioritizes expediency over thorough assessment, even with good intentions, risks misinterpreting the animal's condition and delaying necessary pain management, thereby compromising animal welfare and professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe the animal in its environment, noting posture, movement, vocalization, facial expressions, and interaction with its surroundings. 2. Consider the context of the observation. Is the animal in a novel environment, undergoing a procedure, or recovering from one? 3. Interpret the observed behaviors in light of species-specific knowledge and known signs of pain or distress. 4. Communicate any concerns clearly and promptly to the supervising veterinarian, providing specific behavioral evidence. 5. Collaborate with the veterinary team to develop and implement a pain management plan. This iterative process ensures that the animal's welfare remains the central focus of care. Question 9. Risk assessment procedures indicate that a 12-year-old Labrador retriever with mild renal insufficiency and a history of bradycardia is scheduled for a routine dental prophylaxis. The veterinarian proposes an anesthetic protocol using a combination of a dissociative anesthetic and a short-acting opioid, with no pre-anesthetic medication to reduce the risk of further bradycardia. As the registered veterinary technician responsible for administering anesthesia, you have concerns that this protocol may not adequately address the patient's pain and may exacerbate the risk of bradycardia due to the opioid's potential side effects, especially in a patient with pre-existing cardiac concerns. What is the most appropriate course of action? Option A. Politely express your concerns to the veterinarian, citing the patient's specific risk factors and suggesting a modified protocol that includes a pre-anesthetic agent known to have less impact on heart rate and provides better preemptive analgesia, and request a discussion to reach a consensus on the safest plan. Option B. Inform the client that you have concerns about the proposed anesthetic protocol and suggest they seek a second opinion from another veterinary practice before proceeding with the procedure. Option C. Independently select and administer a different pre-anesthetic medication and analgesic agent that you believe are safer for the patient, without further consultation with the veterinarian. Option D. Proceed with the veterinarian's proposed anesthetic protocol as directed, assuming the veterinarian has considered all factors and is ultimately responsible for the patient's care. The correct answer is A. Politely express your concerns to the veterinarian, citing the patient's specific risk factors and suggesting a modified protocol that includes a pre-anesthetic agent known to have less impact on heart rate and provides better preemptive analgesia, and request a discussion to reach a consensus on the safest plan. Explanation. This scenario presents a professional challenge due to the inherent conflict between client wishes and the veterinarian's professional judgment regarding patient safety and ethical care. The registered veterinary technician, RVT, is tasked with administering anesthesia and analgesia, a critical responsibility that requires adherence to established protocols and a commitment to patient well-being above all else. The veterinarian's directive, while seemingly straightforward, introduces an ethical dilemma when it potentially compromises the established safety parameters for the specific patient. The correct approach prioritizes patient safety and adherence to established veterinary medical standards and ethical guidelines. This involves open communication with the veterinarian, clearly articulating concerns about the proposed protocol based on the patient's specific risk factors and the known safety margins of the chosen agents. It emphasizes the RVT's professional responsibility to advocate for the patient and to ensure that anesthesia and analgesia are administered in a manner that minimizes risk, even if it means questioning a superior's initial plan. This aligns with the core ethical principles of veterinary medicine, which mandate acting in the best interest of the animal and upholding professional standards of care. Regulatory frameworks for RVTs typically require them to practice under veterinary supervision, but also empower them to raise concerns about patient welfare and to refuse to perform acts that they believe are unsafe or unethical. An incorrect approach would be to blindly follow the veterinarian's instruction without question, even if it deviates from standard protocols or known patient risks. This failure to critically assess the situation and advocate for the patient represents a dereliction of professional duty and could lead to patient harm. Ethically, it violates the principle of non-maleficence, do no harm. Regulatory frameworks would likely view this as practicing below the accepted standard of care. Another incorrect approach would be to unilaterally alter the protocol without consulting the veterinarian. While the RVT may have concerns, independent modification of an anesthetic or analgesic plan without veterinary approval is outside the scope of practice for an RVT and constitutes a serious breach of professional conduct and regulatory guidelines. This undermines the veterinarian-client-patient relationship and the established hierarchy of veterinary medical practice. A third incorrect approach might involve delaying the procedure indefinitely due to minor concerns without clear communication or a plan to address them. While caution is warranted, an RVT's role is to facilitate safe patient care, which includes timely intervention when appropriate. Indecision or excessive delay without constructive problem-solving can also negatively impact patient outcomes and client trust. Professional decision-making process in such situations should involve a systematic approach. 1. Identify the ethical conflict, client wishes vs. patient safety and professional standards. 2. Gather relevant information, patient history, physical exam findings, anesthetic risk assessment, known safety profiles of agents, and established protocols. 3. Consult and communicate. Clearly and respectfully discuss concerns with the supervising veterinarian, providing specific reasons based on patient data and professional knowledge. 4. Propose alternatives. If the initial plan is deemed unsafe, suggest modifications or alternative protocols that align with best practices. 5. Document. Record all discussions, decisions, and actions taken. 6. Escalate if necessary, if concerns remain unresolved and patient safety is compromised. Follow established practice protocols for escalating the issue to another veterinarian or practice manager. Question 10. Benchmark analysis indicates that a canine patient presented for a routine examination is exhibiting subtle signs of anxiety, including lip licking, a slightly tucked tail, and avoidance of direct eye contact. The veterinary team needs to proceed with the examination. Which of the following approaches best reflects an understanding of animal behavior, instincts, learning, and communication in this context? Option A. Proceed with the examination as planned, ignoring the dog's body language, assuming it will tolerate the procedures. Option B. Employ low-stress handling techniques, respecting the dog's personal space and offering positive reinforcement to build trust before and during the examination. Option C. Immediately attempt to restrain the dog firmly to complete the examination quickly. Option D. Administer a sedative to the dog to ensure compliance and facilitate a stress-free examination for the team. Correct answer is C. Immediately attempt to restrain the dog firmly to complete the examination quickly. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered veterinary technician, RVT, to interpret subtle behavioral cues in a distressed animal and respond in a manner that prioritizes both the animal's welfare and the safety of the veterinary team. Misinterpreting these cues can lead to ineffective handling, increased stress for the animal, potential injury to the animal or staff, and a breakdown in the human-animal bond, all of which are critical considerations in veterinary practice. Correct approach analysis. The correct approach involves recognizing that the dog's behavior is a form of communication rooted in instinctual fear and learned avoidance. By employing a low-stress handling technique that respects the dog's personal space and avoids direct confrontation, the RVT is demonstrating an understanding of animal behavior principles. This approach minimizes the dog's perceived threat, allowing for a more positive interaction and facilitating necessary veterinary care. This aligns with the ethical obligation to provide compassionate care and minimize animal suffering, as well as the professional responsibility to ensure a safe working environment. Best practice dictates a proactive approach to stress reduction, acknowledging that fear-based behaviors are often a signal of distress rather than aggression without cause. Incorrect approach is analysis. One incorrect approach involves immediately attempting to restrain the dog forcefully. This fails to acknowledge the dog's communication of fear and distress. Ethically, this can be considered a failure to minimize suffering and can escalate the animal's fear, potentially leading to a bite or further trauma. Regulationally, it could be viewed as a failure to provide humane care. Another incorrect approach is to ignore the dog's body language and proceed with routine procedures as if the dog were comfortable. This demonstrates a lack of understanding of animal behavior and its importance in veterinary care. It represents a failure to adapt handling techniques to the individual animal's needs, potentially causing significant stress and anxiety, which is contrary to the principles of animal welfare. A third incorrect approach is to administer a sedative without first attempting to de-escalate the situation through low-stress handling. While sedation can be a valuable tool, it should not be the first resort when behavioral modification techniques are available and appropriate. This approach bypasses the opportunity to build trust and can mask underlying issues that low-stress handling might address. It may also be considered an unnecessary intervention if less invasive methods are effective, potentially violating the principle of providing appropriate and necessary care. Professional reasoning. Professionals should approach such situations by first observing and interpreting the animal's body language to assess its emotional state. This involves understanding common fear and stress signals, e.g., lip licking, yawning, whale eye, tucked tail, avoidance. Based on this assessment, the professional should select handling techniques that are least likely to provoke a fear or stress response. This might involve approaching the animal calmly, speaking in a soft tone, offering treats, and allowing the animal to move at its own pace. If these techniques are insufficient, then more advanced interventions, such as specialized equipment or sedation, may be considered in consultation with a veterinarian. This systematic, behavior-informed approach ensures both animal welfare and team safety. Question 11. Regulatory review indicates that a client is seeking a clear explanation of a recent biopsy result for their pet, which revealed a tumor. The veterinarian has asked the registered veterinary technician, RVT, to communicate the basic findings to the client, focusing on the tissue type and its implications. The RVT needs to explain that the tumor is composed of abnormal epithelial cells that are growing uncontrollably and may be affecting surrounding tissues. Which of the following explanations best fulfills the RVT's professional and ethical obligations in this situation? Option A. The tumor is a type of cancer. It's made of epithelial cells, which are like the skin cells. They're just growing a lot. Option B. The pathologist's report indicates a significant cellular anomaly within the epithelial layer, suggesting a neoplastic process with potential for local infiltration and distant metastases. Option C. The biopsy shows that the tumor is made of abnormal epithelial cells. These are the cells that normally form the lining of organs and surfaces. They are growing too much and might be pressing on or damaging other parts of your pet's body, like the muscles or nerves. Option D. The tumor is a malignant neoplasm originating from the epithelial tissue, characterized by uncontrolled proliferation and potential invasion of adjacent connective, muscle, and nervous tissues, leading to functional impairment. The correct answer is D. The tumor is a malignant neoplasm originating from the epithelial tissue, characterized by uncontrolled proliferation and potential invasion of adjacent connective, muscle, and nervous tissues, leading to functional impairment. Explanation. Scenario analysis. This scenario presents a professional challenge because a registered veterinary technician, RVT, is tasked with explaining complex biological concepts to a client who is likely unfamiliar with veterinary terminology. The challenge lies in translating scientific information about tissue types and their functions into understandable terms, ensuring the client grasps the implications for their pet's health without causing undue alarm or confusion. Accurate and clear communication is paramount to client compliance with treatment plans and fostering trust. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing clear, client-centered communication. An RVT's ethical and professional responsibility, as guided by Veterinary Practice Acts and professional conduct guidelines, is to educate clients effectively. Explaining that the tumor is composed of abnormal epithelial cells, which normally form linings and coverings, and that these cells are growing uncontrollably, provides a foundational understanding of neoplasia. further elaborating that the tumor's function is to grow and potentially spread, impacting surrounding tissues, connective, muscle, nervous, directly relates the microscopic abnormality to observable clinical signs and potential consequences. This approach respects the client's right to understand their pet's condition and empowers them to make informed decisions. Incorrect approach is analysis, an approach that focuses solely on the scientific classification of the tumor without relating it to the pet's condition, fails to meet the ethical obligation of client education. It is technically accurate but professionally inadequate, as it does not translate scientific knowledge into practical understanding for the pet owner. This can lead to client frustration and a lack of engagement with the veterinary team. An approach that uses overly technical jargon without simplification is also professionally deficient. While the RVT may understand terms like sarcoma or carcinoma, the client likely will not. This communication barrier hinders comprehension and can create anxiety. Professional guidelines emphasize clear communication tailored to the audience. An approach that minimizes the seriousness of the diagnosis without providing accurate information is ethically problematic. While it may be intended to reduce client distress, it misrepresents the situation and can lead to a lack of appropriate care or follow-up. Honesty and transparency are cornerstones of the veterinary-client relationship. Professional reasoning. When faced with explaining a diagnosis to a client, an RVT should employ a tiered approach to communication. First, assess the client's apparent level of understanding and comfort with medical information. Second, use analogies and simple language to explain the core concept, e.g., cells that normally form linings are growing out of control. Third, connect the microscopic issue to macroscopic signs and potential impacts on the pet's well-being. Fourth, be prepared to answer questions and offer further clarification. This process ensures that the client receives accurate, understandable information, fostering trust and enabling informed decision-making, aligning with professional standards of care and ethical communication. Question 12. The risk matrix shows a canine patient presenting with lethargy, pale mucous membranes, and a rapid, weak pulse. The owner also reports a history of occasional coughing. Considering the primary organ systems involved in these signs, which diagnostic and therapeutic approach should be prioritized? Option A. Recommend immediate referral for advanced abdominal ultrasound to rule out organomegaly or masses as the primary cause of the systemic signs. Option B. Advise the owner to monitor the pet at home with rest and hydration, suggesting that the signs may resolve spontaneously with time. Option C. Focus on assessing and supporting the cardiovascular system, potentially including cardiac auscultation, blood pressure measurement, and consideration for fluid therapy and oxygen support. Option D. Prioritize investigation of the gastrointestinal system, recommending antiemetics and dietary changes due to the potential for systemic illness manifesting as lethargy. The correct answer is C. Focus on assessing and supporting the cardiovascular system, potentially including cardiac auscultation, blood pressure measurement, and consideration for fluid therapy and oxygen support. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the registered veterinary technician, RVT, to interpret subtle clinical signs related to a specific organ system's dysfunction and to prioritize diagnostic and therapeutic interventions based on that interpretation. The challenge lies in distinguishing between common, less severe symptoms and those indicative of a more serious, potentially life-threatening condition, necessitating a thorough understanding of organ system physiology and pathology. The RVT must also consider the client's financial constraints and the animal's welfare, balancing diagnostic thoroughness with practical limitations. Correct approach analysis. The correct approach demonstrates best professional practice by focusing on a systematic assessment of the patient's presenting signs and correlating them with the known functions of the cardiovascular system. Recognizing that lethargy, pale mucous membranes, and a rapid, weak pulse are classic indicators of compromised cardiac output and potential shock is crucial. This approach prioritizes immediate stabilization and further diagnostic investigation of the cardiovascular system, aligning with the RVT's role in assisting the veterinarian with diagnosis and treatment. This aligns with general veterinary practice guidelines that emphasize prompt assessment and intervention for critical patients. Incorrect approaches analysis. One incorrect approach might involve focusing solely on gastrointestinal signs, such as vomiting or diarrhea, without considering the systemic implications of the other observed signs. This would be a regulatory failure, as it neglects a comprehensive patient assessment and potentially delays critical cardiovascular intervention, violating the principle of providing competent care and acting in the animal's best interest. Another incorrect approach could be to dismiss the signs as minor and recommend only supportive care at home without further veterinary investigation. This represents a significant ethical and professional failure. It fails to uphold the RVT's duty of care, potentially leading to a severe adverse outcome for the animal due to untreated cardiovascular compromise. It also bypasses the veterinarian's role in diagnosis and treatment planning. A third incorrect approach might be to immediately recommend expensive, advanced diagnostic imaging without a foundational assessment of the patient's immediate needs and the most likely organ system involved. While advanced diagnostics can be valuable, prioritizing them over initial stabilization and a targeted diagnostic workup based on presenting signs is inefficient and may not be in the animal's best interest, especially considering potential financial limitations. This could be seen as a failure in prudent resource management and patient-centered care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough patient assessment, including history, physical examination, and vital signs. This assessment should then be used to formulate a differential diagnosis, prioritizing the most likely and most critical conditions. Based on the differential diagnosis, a diagnostic and treatment plan should be developed in collaboration with the veterinarian, considering the patient's immediate needs, potential for progression, and client resources. Continuous reassessment of the patient's response to interventions is paramount. Question 13. The performance metrics show a slight increase in surgical site infection rates for procedures performed by the veterinary team. During a routine surgical procedure, the registered veterinary technician observes that a critical surgical instrument has inadvertently touched the edge of the sterile drape. The veterinarian is focused on completing the procedure efficiently. What is the most appropriate immediate action for the registered veterinary technician to take to uphold aseptic technique and patient safety? Option A. Immediately replace the contaminated instrument with a sterile one from the back table and ensure the sterile field remains intact. Option B. Discard the contaminated instrument and request a new sterile pack to be opened, potentially delaying the procedure. Option C. Alert the veterinarian to the contamination and suggest continuing with the instrument while monitoring the wound closely post-operatively. Option D. Continue the procedure with the instrument, assuming the risk of contamination is minimal given the brief contact. The correct answer is A. Immediately replace the contaminated instrument with a sterile one from the back table and ensure the sterile field remains intact. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered veterinary technician, RVT, to balance immediate patient needs with strict adherence to aseptic technique and regulatory guidelines for surgical site management. The pressure to complete a procedure efficiently can sometimes lead to shortcuts, which, if not carefully managed, can compromise patient safety and violate established veterinary practice standards. The RVT must possess a keen eye for detail and a thorough understanding of the rationale behind each step of aseptic technique and wound care. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by meticulously following established protocols for aseptic technique and wound management. This involves thorough preparation of the surgical site, appropriate use of sterile instruments and drapes, and diligent post-operative wound assessment and care. This aligns with the ethical and legal obligations of an RVT to provide competent care, prevent iatrogenic infections, and uphold the standards set forth by veterinary regulatory bodies, ensuring patient well-being and minimizing risks of complications. Incorrect approaches analysis. An approach that involves reusing a surgical instrument after it has touched a non-sterile surface without proper sterilization or replacement is a direct violation of aseptic technique principles. This significantly increases the risk of introducing pathogenic microorganisms into the surgical site, leading to infection. Such a failure constitutes professional negligence and a breach of the RVT's duty of care, potentially violating regulations concerning infection control and patient safety. Another incorrect approach would be to delay wound assessment or documentation of any irregularities post-operatively. This oversight can lead to delayed identification and treatment of complications, such as dehiscence or infection, negatively impacting patient recovery and potentially leading to more severe outcomes. It also represents a failure to meet documentation standards required by Veterinary Practice Acts and professional guidelines, hindering effective communication within the veterinary team and compromising continuity of care. Failing to maintain a sterile field throughout the surgical procedure, for instance, by allowing non-sterile personnel to cross the sterile field or by not adequately covering exposed sterile items, introduces a high risk of contamination. This directly contravenes the fundamental principles of aseptic technique, increasing the likelihood of surgical site infections. Such a lapse in practice would be considered a failure to adhere to professional standards and could lead to disciplinary action under veterinary practice regulations. Professional reasoning. Professionals should approach surgical procedures with a mindset of meticulous attention to detail and a commitment to patient safety above all else. This involves a proactive approach to infection control, a thorough understanding of the rationale behind each aseptic technique step, and diligent post-operative monitoring. When faced with time constraints or challenging situations, the professional decision-making process should involve 1. Reaffirming the core principles of aseptic technique and wound management. 2. Assessing the potential risks and benefits of any deviation from protocol. 3. Consulting with the supervising veterinarian if uncertainty exists. 4. Prioritizing patient well-being and regulatory compliance over expediency. Question 14. Implementation of a comprehensive post-operative monitoring plan for a canine patient recovering from abdominal surgery, focusing on the maintenance of cardiovascular and respiratory homeostases, requires the registered veterinary technician to: Option A. Administer intravenous fluids at a rate deemed appropriate by the technician based on perceived hydration status, without direct veterinary instruction. Option B. Interpret a single abnormal vital sign, such as a slightly elevated respiratory rate, as an immediate crisis requiring independent intervention with bronchodilators. Option C. Rely solely on the patient's apparent comfort level and absence of overt pain to determine if monitoring can be reduced to less frequent intervals. Option D. Continuously assess and record vital signs, recognizing deviations from expected recovery parameters, and promptly communicating any significant changes or concerns to the supervising veterinarian. Correct answer is D. Continuously assess and record vital signs, recognizing deviations from expected recovery parameters, and promptly communicating any significant changes or concerns to the supervising veterinarian. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of maintaining homeostasis in a post-operative patient. Deviations from normal physiological parameters can rapidly escalate, leading to severe complications or even patient mortality. The registered veterinary technician, RVT, must possess a deep understanding of normal physiological ranges, the potential impact of anesthesia and surgery on these parameters, and the subtle signs of decompensation. The challenge lies in interpreting a constellation of clinical signs and vital signs, distinguishing between expected post-operative adjustments and emergent problems, and acting decisively and appropriately within their scope of practice. Correct approach analysis. The correct approach involves a systematic and evidence-based response that prioritizes patient safety and adheres to established veterinary protocols. This includes continuous monitoring of vital signs, prompt recognition of deviations from baseline and expected post-operative ranges, and immediate communication with the supervising veterinarian. The RVT's role is to provide accurate data and alert the veterinarian to potential issues, allowing for timely diagnostic and therapeutic interventions. This aligns with the ethical obligation to provide competent care and the regulatory requirement to act within the scope of practice, which includes recognizing and reporting changes in a patient's condition. The emphasis on understanding the underlying physiological processes of anesthesia recovery and surgical stress is paramount for effective monitoring and intervention. Incorrect approaches analysis. One incorrect approach involves delaying reporting significant changes in vital signs, such as a persistent drop in blood pressure or a marked increase in heart rate, due to a belief that the patient will spontaneously recover. This failure to act promptly constitutes a breach of professional duty and can lead to irreversible damage or death. Ethically, it violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulationally, it may be considered a failure to provide adequate veterinary nursing care. Another incorrect approach is to administer medications or adjust supportive care without direct veterinary instruction or established protocols. While RVTs have a broad knowledge base, their scope of practice is defined by veterinary supervision. Independent administration of treatments, even if seemingly appropriate based on the RVT's knowledge, can be dangerous if it interferes with the veterinarian's diagnostic plan or therapeutic goals. This represents a regulatory failure by exceeding the authorized scope of practice and an ethical failure by potentially causing harm through unauthorized intervention. A third incorrect approach is to focus solely on one or two vital signs while neglecting others. Homeostasis is a complex interplay of multiple physiological systems. For example, focusing only on heart rate without considering respiration, temperature, or mentation can lead to a misdiagnosis of a critical issue. This demonstrates a lack of comprehensive understanding of physiological processes and a failure to perform a complete patient assessment, which is a core competency for RVTs. Professional reasoning. Professionals should approach such situations by first establishing a clear understanding of the patient's preoperative status and the expected physiological changes post-anesthesia and surgery. They should then implement a structured monitoring plan, continuously assessing all relevant vital signs and observing for clinical signs of distress or decompensation. Crucially, they must maintain open and clear communication with the supervising veterinarian, reporting any deviations from expected parameters or concerning observations promptly and accurately. Decision-making should be guided by established veterinary protocols, the veterinarian's instructions, and the RVT's professional judgment within their scope of practice, always prioritizing the patient's well-being. Question 15. Compliance review shows that a registered veterinary technician is preparing to administer a prescribed non-steroidal anti-inflammatory drug, NSAID, to a canine patient diagnosed with chronic kidney disease. The RVT recalls that NSAID can have nephrotoxic effects and may exacerbate kidney dysfunction. The veterinarian's written order simply states, administer NSAID as prescribed. What is the most appropriate immediate action for the RVT? Option A. Contact the prescribing veterinarian to clarify the order and discuss the potential contraindication in light of the patient's kidney disease. Option B. Administer the NSAID as ordered, as the veterinarian is ultimately responsible for the prescription. Option C. Inform the pet owner that the medication may be harmful due to their pet's kidney condition and ask if they want to proceed. Option D. Ask a senior veterinary assistant for their opinion on whether the NSAID should be administered. The correct answer is B. Administer the NSAID as ordered, as the veterinarian is ultimately responsible for the prescription. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a registered veterinary technician, RVT, must make a critical judgment call regarding medication administration based on incomplete or potentially conflicting information. The RVT is faced with a situation where a prescribed medication has known side effects that could be exacerbated by a patient's underlying condition, and the veterinarian's instructions are not entirely clear on how to proceed. This requires the RVT to apply their knowledge of pharmacology, patient assessment, and professional responsibility to ensure patient safety and adherence to veterinary medical standards. The challenge lies in balancing the veterinarian's directive with the RVT's duty of care and understanding of potential risks. Correct approach analysis. The correct approach involves the RVT proactively seeking clarification from the veterinarian before administering the medication. This aligns with the core principles of veterinary practice and the scope of RVT practice, which emphasizes patient safety and the importance of clear communication within the veterinary team. By questioning the prescription in light of the patient's known conditions and the medication's contraindications, the RVT demonstrates a commitment to ethical practice and patient welfare. This action directly addresses potential adverse drug reactions and ensures that the treatment plan is appropriate and safe for the individual patient. This proactive communication is a fundamental aspect of professional responsibility, preventing potential harm and upholding the standards of care expected of a licensed RVT. Incorrect approach is analysis. Administering the medication without further inquiry, despite recognizing potential contraindications, represents a failure to exercise due diligence and professional judgment. This could lead to serious adverse drug reactions, patient harm, and potential legal or disciplinary action for negligence. It bypasses the critical step of ensuring the medication is appropriate for the specific patient's current health status. Contacting the pet owner to discuss the medication and its potential side effects without prior veterinary authorization is an ethical and regulatory breach. RVTs are not authorized to provide medical advice or alter treatment plans independently. This undermines the veterinarian-client-patient relationship and can lead to misinformation or inappropriate client decisions. Consulting with a colleague who is not directly involved in the patient's care to decide whether to administer the medication is also inappropriate. While collegial discussion can be valuable, the ultimate decision regarding medication administration based on potential contraindications rests with the prescribing veterinarian and the RVT's direct communication with them. Relying on a third party without involving the veterinarian responsible for the patient's care is a deviation from proper protocol. Professional reasoning. When faced with a potential conflict between a prescribed medication and a patient's known conditions or contraindications, the professional decision-making process should always prioritize patient safety and clear communication with the veterinarian. The RVT should 1. Identify the potential risk, recognize the known side effects of the prescribed medication and how they might interact with the patient's existing health issues. 2. Consult the patient's record. Review the patient's history for any relevant information that might support or refute the concern. 3. Seek clarification from the veterinarian. Clearly and concisely communicate the concern to the prescribing veterinarian, providing specific details about the medication, the patient's condition, and the potential contraindication. 4. Document the communication. Record the conversation with the veterinarian, including the date, time, and outcome of the discussion. 5. Follow veterinary direction. Administer the medication only after receiving clear instructions from the veterinarian, or if the veterinarian advises against administration, follow their alternative plan. Question 16. The assessment process reveals a canine patient presenting with sudden onset of severe dyspnea, pale mucous membranes, and a weak, rapid pulse. The patient is obtunded and unresponsive to external stimuli. The veterinarian is en route but not yet present. Which immediate action best reflects a critical care priority for this RVT? Option A. Prepare to perform a tracheostomy to secure the airway, as this is the most definitive intervention for severe dyspnea. Option B. Begin administering a broad-spectrum antibiotic intravenously, as infection is a common cause of sudden respiratory distress. Option C. Attempt to obtain a detailed history from the owner regarding the onset of symptoms and any pre-existing conditions before proceeding with any intervention. Option D. Initiate immediate oxygen therapy via a mask or nasal cannula, and prepare for intravenous catheterization and fluid resuscitation, while alerting the veterinarian to the patient's critical status. The correct answer is D. Initiate immediate oxygen therapy via a mask or nasal cannula, and prepare for intravenous catheterization and fluid resuscitation, while alerting the veterinarian to the patient's critical status. Explanation. This scenario is professionally challenging due to the rapid deterioration of a critically ill patient, demanding immediate and decisive action within a high-pressure environment. The registered veterinary technician, RVT, must balance the need for swift intervention with the requirement for accurate assessment and adherence to established protocols. The core challenge lies in prioritizing interventions when multiple critical issues are present, ensuring patient safety and optimal outcomes while operating within the scope of practice and under veterinary supervision. The correct approach represents best professional practice because it prioritizes immediate life-saving interventions based on a systematic assessment of the most critical physiological derangements. This aligns with established veterinary emergency and critical care protocols, emphasizing ABC's airway, breathing, circulation, and addressing immediate threats to life. Adherence to these principles ensures that the most urgent needs are met first, preventing irreversible damage or death. This approach is ethically sound, demonstrating a commitment to patient welfare and professional competence. It also reflects the RVT's role in assisting the veterinarian by performing delegated tasks efficiently and effectively, contributing to a coordinated team effort in critical care. An incorrect approach that focuses solely on administering a specific medication without a comprehensive assessment of the patient's overall status is professionally unacceptable. This could lead to administering inappropriate treatment, potentially exacerbating the patient's condition or masking a more critical underlying issue. This failure to perform a thorough assessment violates the ethical duty to provide competent care and could be considered a breach of professional standards, potentially leading to disciplinary action if it results in patient harm. Another incorrect approach that involves delaying critical interventions to gather more detailed historical information from the owner, while important, is inappropriate in an acute, life-threatening situation. While client communication is vital, it should not supersede immediate life-saving measures. The ethical failure here is prioritizing non-urgent information gathering over the immediate physiological needs of the patient, potentially leading to irreversible harm or death. This demonstrates a lack of understanding of emergency triage principles, an incorrect approach that involves attempting procedures beyond the RVT's scope of practice, even with good intentions, is a significant regulatory and ethical failure. RVTs must operate within their defined legal scope of practice, which is established by Veterinary Practice Acts and regulations. Performing procedures outside this scope, even if they believe it would benefit the patient, constitutes practicing veterinary medicine without a license and can result in severe legal and professional consequences, including license revocation. This demonstrates a lack of professional judgment and in disregard for regulatory boundaries. The professional decision-making process for similar situations should involve a rapid, systematic assessment of the patient's vital signs and immediate threats. This includes evaluating airway patency, respiratory effort and oxygenation, cardiovascular status, heart rate, rhythm, pulse quality, blood pressure, and neurological status. Based on this assessment, the RVT should identify the most life-threatening issues and prioritize interventions accordingly, always working under the direct or indirect supervision of a veterinarian. Communication with the veterinarian should be clear, concise, and focused on the patient's critical status and proposed interventions. Documentation of all assessments and interventions is crucial for continuity of care and legal protection. Question 17. The monitoring system demonstrates a consistent drop in blood pressure during a delicate dissection phase of an orthopedic surgery. The veterinarian requests a fine-tipped, serrated instrument for tissue retraction to improve visualization. You observe a collection of instruments on the sterile tray, including a mosquito hemostat, a Metzenbaum scissors, and a backhouse towel clamp. Which instrument is most appropriate for the requested task of fine tissue retraction to enhance visualization? Option A, a Metzenbaum scissors. Option B, a fine-tipped serrated tissue forceps. Option C, a mosquito hemostat. Option D, a backhouse towel clamp. Correct answer is D, a backhouse towel clamp. Explanation. This scenario presents a common challenge in veterinary surgical settings. Ensuring the correct instrument is readily available and used appropriately to maintain surgical site integrity and patient safety. The registered veterinary technician, RVT, must possess not only the ability to identify instruments, but also to understand their specific applications and the potential consequences of misuse. This requires a deep understanding of surgical principles and adherence to established protocols, which are implicitly governed by the standards of care expected of a licensed professional. The correct approach, which involves accurately identifying the instrument based on its design and intended surgical function, represents best professional practice. This aligns with the RVT's responsibility to assist the veterinarian effectively and safely during surgical procedures. Proper instrument identification ensures that the correct tool is used for the specific task, minimizing tissue trauma, preventing iatrogenic injury, and contributing to a sterile surgical field. This directly supports the veterinarian's efforts and upholds the standard of care expected of a veterinary practice, which is a fundamental ethical and professional obligation. An incorrect approach of selecting an instrument based solely on its general category, e.g., cutting instrument, without considering its specific design and intended use is a significant professional failure. This demonstrates a lack of detailed knowledge and can lead to the selection of an instrument that is inappropriate for the surgical task. For instance, using a heavy-duty scalpel blade designed for gross dissection on delicate tissues could cause excessive tearing and bleeding, violating the principle of minimizing patient harm. This failure to exercise due diligence in instrument selection can be construed as negligence and a breach of the standard of care, potentially leading to adverse patient outcomes and professional disciplinary action. Another incorrect approach, such as choosing an instrument based on its perceived similarity to another without confirming its specific function, is equally problematic. This highlights a superficial understanding and a reliance on assumption rather than precise knowledge. If an instrument is mistaken for another with a different purpose, e.g., mistaking a tissue forceps for a needle holder, it can lead to improper tissue handling, damage to the instrument itself, or failure to perform the intended surgical step effectively. This demonstrates a lack of critical thinking and attention to detail, which are essential for safe surgical assistance. A third incorrect approach, such as selecting an instrument based on its availability rather than its suitability for the surgical step, represents a prioritization of convenience over patient safety. This indicates a failure to understand that each surgical instrument has a specific design for a specific purpose. Using a readily available but inappropriate instrument can compromise the surgical field, lead to unintended tissue damage, and prolong the procedure. This demonstrates a disregard for the principles of aseptic technique and surgical efficiency, which are core components of professional veterinary surgical practice. The professional reasoning process for similar situations should involve a systematic approach. 1. Confirm the surgical step. Understand precisely what the veterinarian needs to accomplish. 2. Visualize the instrument. Recall or refer to the specific instrument designed for that task, considering its material, shape, and mechanism. 3. Identify the instrument. Visually confirm the instrument's features and compare them to its known function. 4. Verify the function. If there is any doubt, discreetly confirm the instrument's purpose with the veterinarian before handing it over. 5. Maintain sterile field. Ensure all instrument handling adheres to aseptic techniques. Question 18. Investigation of a registered veterinary technician's response when a prescribed antibiotic, known to be a bacteriostatic agent that inhibits protein synthesis, is ordered for a patient presenting with a severe, rapidly progressing bacterial infection, where a bactericidal agent is typically indicated. The RVT has reviewed the patient's chart and confirmed the diagnosis and the veterinarian's order. Option A. Administer the prescribed antibiotic as ordered, assuming the veterinarian has a specific reason not immediately apparent to the RVT. Option B. Seek immediate clarification from the veterinarian regarding the choice of antibiotic, explaining the concern about the drug's bacteriostatic mechanism of action in the context of a severe infection. Option C. Discuss the perceived discrepancy with a senior veterinary assistant to get their opinion before proceeding. Option D. Independently substitute the prescribed antibiotic with a bactericidal agent that the RVT believes is more appropriate for the patient's condition. The correct answer is B. Seek immediate clarification from the veterinarian regarding the choice of antibiotic, explaining the concern about the drug's bacteriostatic mechanism of action in the context of a severe infection. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting a veterinarian's orders, which could lead to patient harm. The registered veterinary technician, RVT, is faced with a situation where a prescribed medication's mechanism of action, as understood by the RVT, seems to contradict the intended therapeutic outcome based on the patient's presenting signs. This requires the RVT to exercise critical judgment, applying their knowledge of pharmacology and understanding of their scope of practice to ensure patient safety and adherence to veterinary directives. Correct approach analysis. The correct approach involves seeking clarification from the veterinarian. This aligns with best professional practice and regulatory expectations for RVTs. RVTs are trained in basic pharmacology, including drug classifications and mechanisms of action, but their role is to administer medications as prescribed and to identify potential issues that warrant veterinary attention. By questioning the order and seeking clarification, the RVT demonstrates a commitment to patient welfare, adherence to the veterinarian-client-patient relationship, and responsible medication administration. This proactive communication prevents potential errors and ensures the patient receives appropriate care. Regulatory frameworks for RVTs emphasize the importance of working under veterinary supervision and reporting any concerns that could impact patient health. Incorrect approach is analysis. One incorrect approach is to administer the medication as prescribed without seeking clarification, despite the perceived contradiction. This fails to uphold the RVT's professional responsibility to ensure patient safety. If the medication is indeed inappropriate or incorrectly prescribed, administering it could lead to adverse drug reactions, treatment failure, or exacerbation of the patient's condition. This approach neglects the RVT's duty to critically evaluate and question orders when there is a genuine concern for patient well-being, potentially violating ethical guidelines regarding competence and diligence. Another incorrect approach is to independently decide to withhold or alter the dosage of the medication based on the RVT's own interpretation of the pharmacology. This oversteps the RVT's scope of practice. While RVTs have pharmacological knowledge, the ultimate decision-making authority regarding diagnosis, treatment plans, and medication regimens rests with the veterinarian. Such an action would constitute practicing veterinary medicine without a license and could have severe legal and ethical repercussions, including disciplinary action from the Veterinary Licensing Board. A third incorrect approach is to discuss the perceived discrepancy with a colleague without consulting the veterinarian. While peer consultation can be valuable, it does not replace the need for direct communication with the prescribing veterinarian. The colleague may not have the full clinical picture or the authority to resolve the issue. Relying solely on peer advice without involving the veterinarian delays proper resolution and still leaves the potential for error unaddressed, failing to meet the professional standard of care. Professional reasoning. When faced with a perceived discrepancy between a prescribed medication's mechanism of action and the patient's condition, the professional decision-making process should prioritize patient safety and adherence to the veterinary directive. The first step is to access and review the patient's medical record to ensure a complete understanding of the clinical context. Next, the RVT should consult their knowledge base regarding the specific drug and its known effects. If a discrepancy remains, the immediate and most crucial step is to communicate this concern directly and professionally to the prescribing veterinarian, clearly articulating the observed signs and the pharmacological concern. This communication should be documented. The veterinarian can then provide clarification, adjust the order, or explain the rationale behind the prescription. This systematic approach ensures that all actions are taken within the scope of practice, ethically sound, and focused on optimal patient outcomes. Question 19. What factors determine the optimal method for collecting and preparing a cytology sample for evaluation by a veterinary pathologist, ensuring cellular integrity and diagnostic accuracy? Option A. The speed at which the sample can be collected and processed, assuming the laboratory can correct any minor preparation errors. Option B. The specific tissue or fluid being sampled, the suspected pathology, the chosen staining technique, and the need to minimize cellular artifact during collection and preparation. Option C. The availability of specific collection supplies and the RVT's general knowledge of cytology without considering the specific diagnostic context. Option D. The veterinarian's preference for a particular collection instrument and the RVT's familiarity with common laboratory submission forms. The correct answer is B. The specific tissue or fluid being sampled, the suspected pathology, the chosen staining technique, and the need to minimize cellular artifact during collection and preparation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered veterinary technician, RVT, to make critical decisions regarding sample quality and preparation that directly impact diagnostic accuracy. The veterinarian relies on the RVT's expertise to obtain and prepare samples that are representative of the underlying pathology. Errors in collection or preparation can lead to misdiagnosis, delayed treatment, or unnecessary further testing, all of which have significant implications for animal welfare and client trust. The RVT must balance efficiency with meticulous technique, understanding that even subtle deviations can compromise the integrity of the cytology. Correct approach analysis. The correct approach emphasizes the RVT's direct responsibility for ensuring the sample is suitable for evaluation. This aligns with the scope of practice for an RVT, which includes performing diagnostic procedures and preparing samples for laboratory analysis. The RVT's knowledge of cellular morphology, staining techniques, and potential artifacts is crucial for producing a high-quality slide. This proactive approach minimizes the risk of inadequate samples reaching the pathologist, thereby supporting accurate and timely diagnoses, which is a core ethical and professional obligation. Incorrect approaches analysis. One incorrect approach focuses solely on the veterinarian's role, implying the RVT's responsibility ends with simple collection. This fails to acknowledge the RVT's training and expertise in sample preparation and quality control, which are integral to diagnostic cytology. Ethically, this approach abdicates a key responsibility and could lead to substandard diagnostic material being submitted. Another incorrect approach prioritizes speed over meticulous technique, suggesting that a good enough sample is acceptable. This overlooks the potential for artifacts introduced by rush preparation, such as smudging, overfixation, or uneven cell distribution, which can obscure important cellular details. This disregard for quality control can lead to diagnostic errors, violating the ethical duty to provide competent care. A third incorrect approach relies on the assumption that the laboratory will fix any issues. While laboratories strive for accuracy, they cannot compensate for fundamentally flawed samples. Over-reliance on laboratory correction shifts responsibility away from the RVT and can mask underlying deficiencies in technique, hindering professional development and potentially compromising patient care. Professional reasoning. Professionals should approach cytology sample collection and preparation with a systematic mindset. This involves understanding the specific diagnostic goals for each sample type, selecting the appropriate collection method to minimize contamination and trauma, and employing meticulous preparation techniques to preserve cellular morphology. A critical self-assessment of the prepared slide for common artifacts and adequacy is essential before submission. When in doubt, consulting with the veterinarian or a cytologist is a sign of professional responsibility and a commitment to patient welfare. Question 20. When evaluating the clinical chemistry results of a feline patient presenting with lethargy and decreased appetite, which of the following approaches best reflects the role of a registered veterinary technician in assisting with diagnostic interpretation? Option A. Dismiss any biochemical abnormalities that fall slightly outside the reference range, assuming they are due to stress from the clinic visit, and proceed with supportive care only. Option B. Focus exclusively on identifying a single biochemical marker that perfectly matches a textbook description of a common feline disease, without considering the full spectrum of the patient's results or clinical presentation. Option C. Systematically review all available biochemical parameters, correlate any abnormalities with the patient's signalment, history, and physical examination findings, and consult with the supervising veterinarian for further diagnostic and therapeutic planning. Option D. Prioritize the interpretation of the most significantly elevated enzyme, such as alkaline phosphatase ALP, and immediately recommend a liver-specific diagnostic workup based solely on this finding. Correct answer is D. Prioritize the interpretation of the most significantly elevated enzyme, such as alkaline phosphatase ALP, and immediately recommend a liver-specific diagnostic workup based solely on this finding. Explanation. Scenario analysis. This scenario presents a common challenge for registered veterinary technicians, RVT, involving the interpretation of clinical chemistry, results in a patient with a complex clinical presentation. Challenge lies in integrating multiple biochemical parameters, understanding their interrelationships, and correlating them with the patient's signs and history to formulate a differential diagnosis and recommend appropriate diagnostic or therapeutic next steps. Without a systematic approach, an RVT could misinterpret the data, leading to delayed or incorrect patient management, potentially impacting patient welfare and violating professional standards of care. Correct approach analysis. The correct approach involves a systematic evaluation of each biochemical parameter in the context of the patient's overall clinical picture. This includes considering the normal reference ranges for the species, the direction and magnitude of any abnormalities, and potential physiological or pathological reasons for these changes. Crucially, it requires correlating these findings with the patient's signalment, history, and physical examination findings. For example, elevated BUN and creatinine in a dehydrated patient might be interpreted differently than in a well-hydrated patient with signs of urinary obstruction. This holistic and integrated approach aligns with the RVT's role in assisting the veterinarian with diagnostics and patient care, ensuring that interpretations are clinically relevant and contribute to effective patient management. This reflects the ethical obligation to provide competent care and uphold professional standards as outlined by veterinary regulatory bodies. Incorrect approach is analysis. Focusing solely on one abnormal value without considering others or the clinical context is a significant failure. For instance, identifying an elevated ALP and immediately assuming liver disease without investigating other potential causes, e.g., bone growth in young animals, corticosteroid use, or other liver enzyme elevations, ALP, GGT, would be a diagnostic oversimplification. This approach risks misdiagnosis and inappropriate treatment. Another incorrect approach is to dismiss all abnormal values as insignificant without further investigation or consultation. This can lead to overlooking serious underlying conditions. For example, a mild elevation in glucose might be dismissed in a stressed animal, but if persistent or accompanied by other signs like polyuria and polydipsia, it could indicate diabetes mellitus. This failure to thoroughly investigate potential abnormalities can be seen as a breach of the duty of care. Finally, relying solely on a textbook definition of a disease without integrating the specific patient's data is also problematic. While textbooks provide valuable information, each patient is an individual, and their biochemical profile may present with nuances not perfectly captured by generalized descriptions. This can lead to a rigid and potentially inaccurate diagnostic pathway. Professional reasoning. When evaluating clinical chemistry results, the RVT should employ a decision-making framework that prioritizes a comprehensive and integrated approach. This framework involves 1. Reviewing the patient's signalment, history, and physical examination findings. 2. Examining each biochemical parameter against species-specific reference ranges, noting the direction and magnitude of any deviations. 3. Considering the physiological interrelationships between different analytes, e.g., how kidney function can affect electrolyte balance or BUN. 4. Correlating biochemical abnormalities with the patient's clinical signs and history to generate a list of differential diagnoses. 5. Consulting with the supervising veterinarian to discuss findings, propose further diagnostic tests, or initiate treatment. 6. Documenting all findings and interpretations accurately. This systematic process ensures that interpretations are clinically relevant, ethically sound, and contribute to optimal patient care.